Well, it's time now for Thursday Health Report, and joining us now is Africa 54 health correspondent Linord Moudou with the latest news on Ebola. Hello, Linord.
Hello, Vincent. An Italian nurse has tested positive for Ebola after returning from Sierra Leone. The man began to feel sick at his home in Sardinia on Sunday evening and was taken to a local hospital. He became ill 2 days after coming back from the West African state where he had been treating patients for the disease. The patient tested positive for Ebola and was immediately transferred by a military plane to a Rome hospital where he is now being treated. Liberia was declared officially Ebola-free by the World Health Organization after 42 days of no new infections. But various ailments still plague those who survived the virus, including debilitating eye conditions like vision loss. Jamama Kone is on her way to the Cooper Adventist Hospital in Monrovia to see an ophthalmologist. Kone survived the recent Ebola outbreak in the country, but now she is struggling to cope with the impact of the disease, which she says affected her vision and jaw. It's a complaint some doctors say is common among survivors of the West African outbreak.
My job, the doctor said that the job is dislocated. And it hurts me a lot. I can't chew, I don't talk well. Then my eye too, they're red, I can't see. It happened during the time I was in coma, so they eating you. When I came from in coma, I noticed my mouth was wide open and the eye was closed, it couldn't open.
The United Nations says over 8,000 people survived Ebola. Some survivors are complaining of side effects months after their recovery, a condition some doctors are now calling post-Ebola syndrome. The symptoms reported include joint pain, hair and memory loss, and vision problems.
Anyway, they are coming with different cases. Some people are coming down with refractive area. Some people are coming down with uveitis. Some are coming down with pingo coli.
Medical experts say it is not yet clear how long the post-viral complications last, and there is also no scientific literature or medical consensus on any new syndrome among survivors.
Eye surgeon not to know, especially those who do invasive, that means going inside the eye to work, to know that the virus can be harbored in the eye of a survivor. Now, he cannot tell you how long it is. Even it's a mystery now to know how long the virus can be harbored also in the eye.
Ebola killed over 11,000 people in Liberia, Guinea, and Sierra Leone. For Ebola survivors like Kone with post-Ebola syndrome, the struggle continues. Joining us live via Skype from Geneva, Switzerland, for more on the subject is Dr. Margaret Harris, spokesperson for Ebola with the World Health Organization. Dr. Harris, welcome to the program.
Thank you very much. It's a pleasure to be with you.
So the virus lives on in someone's eyes. This is a really troubling. Can you tell us about this phenomenon?
Yes, this is something that was mentioned in previous reports of Ebola outbreaks. But as you know, there were small numbers of people in very remote places. And unfortunately, nobody really followed those patients through. With this very large outbreak, we've had a number of our doctors then work with survivors, and it's become very clear to us that this is a very serious problem, that for some people, they have symptoms that are really very debilitating, like blindness or hearing loss or joint pains, that need to be investigated and they need to be looked after. So we've launched a research project to follow these people through and to try to understand what their problems are, so that we can help them as best possible.
So are all these symptoms observed with all survivors, and if not, are some people predisposed to developing this?
It's not all survivors. So for instance, in some groups up in Kenema in eastern Sierra Leone, we found that as many as half the survivors, but it was a small group, but half the survivors that we were looking after there did complain of eye problems. In the most recent case in America, they actually found that there was virus persisting in the eye. And this is because the eye and some other parts of the body, such as the testicle, is protected from the immune system because you don't want your immune system attacking your eyes for no reason. So it's what we call an immune sanctuary. And it seems that in a very small number of people, the virus is able to stay there.
Okay, now given that there are no specific studies about this problem, what are the recommendations?
At the moment, the recommendations are to investigate every person, to follow every person who has had Ebola, and to see what their particular symptoms are, and then to treat those symptoms symptomatically. What I mean by that is, so if you have joint pains, we have specific medicines for those joint pains. If you have headaches, we have specific medicines for those headaches. And where it's eye symptoms, we need ophthalmologists. So we urgently need ophthalmologists to come and work with post-Ebola, with people who've survived Ebola.
And very quickly, could this be related to the type of Ebola strain, maybe?
No, we've not seen any evidence of that. The Ebola strain has been pretty consistent, but one of the things we are doing now, with every person we find who has Ebola, we immediately do some genetic testing.
Okay, Dr. Harris, thank you so much for joining us. And that was Dr. Margaret Harris, as she is spokesperson for Ebola with the World Health Organization. That's our Africa Health Report for today. Vincent?
Well, Linord, thanks a lot. And I'll be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.